Assalamu alaikum, this is Dr. Hasna with Hasna's Anatomy, and today we're discussing the cavernous sinus. We have already discussed the dural venous sinuses in the previous video, and now I'm going to talk about this very important paired sinus that lies on either side of your sphenoid bone. This is known as the cavernous sinus. Actually quite important, therefore I've given like a whole video dedicated to this. So guys, subscribe to my channel. Do not forget to click a like on the video, comment if you have any topics or any suggestions, and let's get started with the video. I've already told you that sinuses are spaces located in your cranial cavity which carry venous blood, and for these spaces God has made all of these sulcus and grooves just to accommodate those spaces. Basically your sinuses are lying between two layers of the endosteal and meningeal layer of your dura mater, which is the outermost covering of the meninges of the brain. Basically meninges are the coverings of the brain, right? So therefore, now let's talk about the definition of the cavernous sinus. It is a large venous space situated in the middle cranial fossa. It's located on either side of the body of the sphenoid bone. So about here is where you'll find the two cavernous sinus on either side of this body. Its relations are super important, and then its incoming channels, what drains into the cavernous and what drains out of it, its communications are super important. Therefore, I've taken this book right here, because there's some very important diagrams that I have to explain from this book itself. Cavernous sinus, basically anteriorly it begins from the medial end of the superior orbital fissure, goes all the way back to extend up to the apex of the petrous temporal bone. What are the relations of this sinus? So I just want you to know, very important, interesting relation of the sinus is that this is the superior part, this is the inferior part, this is your right and left, suppose, right? So guys, I want you to remember it goes like the nerves of your brain, they go like 2, 3, 4, 5 and 6. So you can see in relation to the superior part of your cavernous sinus is the second cranial nerve. So guys, cranial nerves are nerves originating directly from the brain. These are 12 in number, and each of them have a unique name and a unique journey. So the second nerve is known as the optic nerve. Then we have the third nerve, the oculomotor. We have the trochlear nerve. We have the maxillary nerve, and in the medial area, we have the sixth nerve. So it goes like 2, 3, 4, 5, 6. So if you cannot remember the relations of cavernous sinus, at least know this, that above is 2, then 3, 4, 5, and then 6 in the medial area. So guys, if I talk about relations now, so I know that in the superior relation of the cavernous sinus, I have my second nerve, which is the optic nerve. In the lateral wall, I have the third, fourth, fifth nerve, the oculomotor, the trochlear and maxillary ophthalmic divisions of the trigeminal nerve. And finally, in the medial wall, I have the abducent nerve, which is the sixth nerve. Right now, let's talk about the relations in depth. In the superior area that overlies the superior part of your cavernous sinuses, over here lies your optic chiasma, your optic tract, even your internal carotid artery passes superior to it. All right. Inferiorly, if you see, you guys can see that the junction between the body of the sphenoid with the greater wing of the sphenoid is lying in the inferior relation of the cavernous sinus right here. And if you go posteriorly, you'll see this foramen. This is the foramen lastrum. Medially, what do you think lies here? What lies in this fossa? It's the pituitary gland. Laterally is the content of the middle cranial fossa, which is the temporal lobe of the brain. Anteriorly, we've already talked about, is the superior orbital fissures, medial end, and the apex of the orbit. Posteriorly is the apex of the petrous temporal bone. So I guess these relations are very easy. Now, the important question that will be asked in the cavernous sinus is going to be about its lateral wall relations. Now, lateral wall relations are very important. But guess what? You know most of them because you've learned the 2, 3, 4, 5, 6 rule. Let me just orient you with this diagram. This is that sella turcica area of the body of the sphenoid bone. On either side, we know the two cavernous sinuses are lying, right? So this is the cavernous sinus, this is the medial, this is the superior, this is the inferior, this is the lateral. So what you can see here in the superior part, we have what? The second nerve, the optic nerve. Makes sense? And an internal carotid artery also comes in the superior relations. Now, what is important is what will be asked in your examination is this important relation known as the relation of the lateral wall of cavernous sinus from above downwards. From above downwards, I've already given you the gist of it, is the third, fourth, fifth cranial nerves. So it goes like OTOM, the oculomotor nerve, The T is for the trochlear nerve. And we go for the trigeminal nerves, two divisions, V1, V2. These are the ophthalmic nerve and the maxillary nerve. However, although the third division of the trigeminal actually comes in the inferior relation of the cavernous sinus, is the mandibular nerve. It's not related to the lateral wall. The OTOM structures are the lateral wall structures. So this becomes really easy if you learn it in the 2, 3, 4, 5, 6 rule. Let's talk about the medial aspect of the sinus. You can see internal carotid artery and the sixth nerve, the abducent nerve. Let's talk about the tributaries of the cavernous sinus. This is another important question that will be asked. So for sinuses, mostly you will be asked either the incoming channels or the outgoing channel. You can also call them the tributaries, and the communications of every sinus will be asked. Here I like to explain this diagram to you. Basically what you can see is we've already talked about some part of this area. If I want you to forget this right now, okay, focus on this. The supraorbital and supratrochlear vein, when they mingled, they formed what you call the angular vein, which continued as the facial vein. Another important thing that we've already discussed is that the deep facial vein from the facial vein went inside to communicate with the pterygoid venous plexus, and via the emissary vein this entered your intracranial area in the cavernous sinus. We've already talked about this in the dangerous area of the face. Let's talk about the tributaries, what's draining into the cavernous sinus. So from your orbital area, your superior ophthalmic vein, your central vein of retina, and the inferior ophthalmic vein, in that order, are going to drain into the cavernous sinus. So these are your first important tributaries coming from this orbital area. The next tributaries, these are coming from your brain. So in the brain area, what do you think will come? The middle cerebral and the inferior cerebral vein. Next, what you'll see is from the meninges, the branches that are going to come are the middle meningeal vein and the sphenoparietal sinus that's lying right here. So these are the tributaries that are incoming into the cavernous sinus. Now let's talk about what drains out of the cavernous sinus, or also call these the communications of the cavernous sinus. So the most important communication is the pterygoid venous plexus, which lies right here, inferior to your skull, this area right here. So just below the cavernous sinus is known as the pterygoid venous plexus. This pterygoid venous plexus, in it enters your deep facial vein, which is coming from the dangerous area of the face, right? And from the pterygoid venous plexus, there are emissary veins. What are the emissary veins? I've already told you, connecting your extracranial to the intracranial venous channels. This communication is the most important communication, the first communication that you're going to talk about. And next communication is that your cavernous sinus, now we're going to shift to this diagram too. Let me give you an orientation of this. This is the entire structure of all the sinuses and how they work. This is, you can see, this is coming from posterior anterior. This is the anterior part, this is the posterior part. And you can see your entire sinuses, how they're draining. We all know your transverse sinuses are coming from posterior, and then they go ahead and become the sigmoid sinuses. We had the basilar plexus of veins. This is lying on the clivus area. And then this is your sphenoid bone body. On either side, your cavernous sinus is lying. Both of these sinuses are communicating with each other as well through the anterior and the posterior intercavernous sinuses. I want you to remember these two important connections via the superior and inferior petrosal sinus. All right. You can see this is basically your transverse sinus. It is becoming the sigmoid sinus, and we all know the sigmoid sinus, because it was entering the jugular foramen, it becomes, what does it become? The superior bulb of your internal jugular vein. Cavernous sinus is basically, how does it get its blood to the heart? Through, somehow you have to get to the internal jugular vein, right? So what it does, it has two communications. First communication is via the superior petrosal sinus. If we talk about the skull, we're talking about this area right here, superior border of the petrous temporal bone. This is the jugular foramen right here. This is the sigmoid sinus, and this is the inferior petrosal sinus. So the cavernous sinus is lying right here. First connection, important connection it makes, it drains via the superior petrosal sinus into the transverse sinus that lies over here, and via the inferior petrosal sinus it enters, this is the jugular foramen. So what do you think it enters? The internal jugular vein. So you can see all these sinuses are interconnected to each other, and they're valveless, so there is no unidirectional flow of blood. Eventually, just indirectly or directly has to enter the heart, right? Fifth, I want you to remember this tiny relation, just add to all of that, is that through the superior ophthalmic vein it is connected to the facial vein. So once you understand these tributaries and these connections, you are going to ace these two diagrams. You will probably be asked to draw one of these in the examination, so you will know very well what they mean. Basically, this diagram is telling you an overall view of the cavernous sinus, what connections is it forming. And in this diagram, it's basically giving you a gist of how all the sinuses are connected to each other and also showing some important relations of the cavernous sinus. Final clinical I'm going to talk about is your cavernous sinus thrombosis. If there is thrombosis of the cavernous venous sinus, we've already talked about how that can happen if there is any, like suppose infection here and it travels via the emissory veins into it. What are the symptoms that are going to occur? So if we're talking about all the nerves that lie in relation to this sinus, if this undergoes thrombosis, meaning clotting, these nerves will be affected. So the paralysis of the muscles that these nerves are supplying are going to occur. And apart from that, the major sign that's going to occur is that the venous blood flow is being interrupted. What happens when venous blood flow is interrupted? Your blood is not flowing back to the heart, which means your blood is undergoing stasis. It's remaining in an area, which means what will happen? Swelling. Swelling will start occurring because your veins will be filled up with blood. You will see that the patient will present with your edema of the eyelids. The cornea, the root of the nose, all of these will be edematous. Apart from that, your eyes will be protruding forwards. This is known as the exophthalmos. And then the symptoms that are occurring in relation to the nerve compression, this is going to cause pain, severe pain in the eye, because that is the different distribution of your ophthalmic nerve, and involvement of the cranial nerves, third, fourth, sixth, there, but obviously whatever those muscles they are supplying, that is going to happen. Now, sometimes what happens is your communication between the cavernous sinus, because it's lying close relation to the internal carotid artery. Usually in a head injury, your connection which is formed between the internal carotid artery and the cavernous sinus, it leads to your eyeball protruding forward because of the congestion. And the eyeball is pulsating. This is known as the pulsating exophthalmos. This occurs because internal carotid artery, obviously the pulsations from that are coming over here, and since this is close relation to the superior orbital fissure in your orbit, so your eyes will pulsate in that fashion. So guys, that was all you needed to know about the cavernous sinus. I really hope you understood today's lecture. Thank you so much for watching.